so we might get done in a reasonable amount of time. Today we're talking about communication with cognitively impaired patients so that you might get a little bit more cognitive when you're talking to these people, how you're talking to these people, and whether or not they can actually understand you. Okay? How communication happens, you have a message and a response, but you have a sender and a receiver. Okay? There are 5 critical factors that make successful communication. First, you have to have the sender, the person who wants to start the communication. You have to have the message that's formed by the sender. Then you have to have a medium. The sender will choose how they're going to communicate, whether it's speaking, writing, typing, computer, etc., or even sign language. Then the receiver is someone who must hear, read, or see the message and understand its meaning. Okay? Then you have to have feedback. The receiver must provide feedback so that they can understand, they understood what went on. Okay? So what can go wrong with these factors? Ladies, listen up, please. Okay? What are some of the things that can go wrong? A sender can fail to form a clear message. Okay? For example, a sender may say, you need coronary bypass to mitigate your myocardial insufficiency. Well, if you're a layperson, they're talking gibberish to you, right? Are you missing with my thing over here? No. Okay. So then you have the medium. And the medium, swap it around and see if one of them works better. The medium may not be appropriate also. It can be providing written instructions to someone who can't read, okay? Or the receiver may have a barrier, such as a hearing loss or a visual impairment, a brain injury. There are different types of things that can cause that. Strokes and Alzheimer's. What are some of the common receiver problems? What would you think would be on the receiving end? Why might your patient not be able to understand you? Hearing impairment, or they may be deaf. Maybe they have visual impairments or blindness. How about brain abnormalities? They've had a stroke, and it can cause aphasia, which prevents them from letting you know they understood what you said. Okay? Dementia, Alzheimer's disease, brain tumors, traumatic brain injury. Yeah. What about medication? The side effects from meds, narcotics can cause excessive fatigue, and antidepressants. What about if the patient has cultural differences? Maybe this is not their dominant language. Okay? Or maybe they're illiterate and they can't read or write. Okay? What about structural problems? What do you think structural problems are? How about tracheostomies, breathing tubes, nasogastric tubes, cleft palates, or recent surgery in the mouth or throat? Okay? So 2 things can go wrong in that scenario. The reception or the receptive communication refers to the way a listener receives and understands your information. Okay? So a person who's hard of hearing and doesn't speak the language, or is someone who is confused, may not understand at all. They're gonna look at you like, huh? And then if they have expressive communication problems. Expressive communication problems refers to how a person conveys a message. This is done by gesturing, speaking, writing, sign language, different things like that. Okay? What about communicating with the hearing impaired? What? Keep in mind that people with hearing problems will hear even less when they are tired, sick, or stressed. Okay? So when you get home and you're tired, you're stressed out, you don't want to hear it. Okay? So even your client with mild hearing loss can suddenly seem like they've got a major hearing loss just because they're tired. Okay? So if the person wearing a hearing aid, you might want to check to make sure, number one, that it's turned on. Number two, that it's clean. Number three, it's got the appropriate battery in it. And you want to try to find out when the last time they had a hearing evaluation done. Okay? You also, those type of patients, you want to stand directly in front of them when you talk to them so they can watch your mouth move. Okay? Because a lot of times they're reading lips. Okay? You want to reduce or eliminate as much background noise as possible. And you want to speak in your normal voice. Don't shout. Okay? If you have a high voice, you might want to try to make it a little deeper. Use lower tones. How do you communicate with a deaf person? Sign language. What if you don't know sign language? You can write it if the person can read, right? What if they can't read? Pictures. Right. And some deaf people are very, very adept at reading lips. Okay? Now, you have a patient that's visually impaired. How are you going to communicate with them?
Talk clearly.
Ask your patient what helps. Okay? Do they need more lighting? If they're legally blind, that doesn't mean that they can't see at all. It just means it's impaired. Okay? And always leave things where they're used to having them unless the client specifically asks you to move it somewhere else. Okay? Okay, what about a patient that's had a stroke? Okay, a stroke can affect the way people send and receive messages. A stroke survivor may have a problem understanding speech. That's known as receptive aphasia. Okay? And others have trouble trying to say what's on their mind, and that's called expressive aphasia. They know it here, but they can't get it out here. Okay? And some stroke patients have both problems. Okay? Let's see. So what you want to do for them is you want to speak slowly and clearly. Keep your voice low and unhurried. Don't jibber jabber because they can't understand it, and don't use baby talk. Okay? Strokes don't usually cause hearing impairment, so unless they already had a hearing problem, they can probably hear you just fine. Okay? Avoid raising your voice. You want to talk in a tone that's easy to understand, just like your normal speaking voice. Okay? Face your client directly when you're speaking to them. That way you don't scare them if you come up behind them and say, "Oh, hi," and pat them on the back. You know, they'll jump 40 feet. You know? Ask one yes or no question at a time. Because you don't want to give too much too fast. Okay? Be patient and give them plenty of time to be able to say what they want to say. We get to be where we're in such a big hurry to get to where we're going that we don't stop and slow down sometimes. Write and read. Try having your client write the word he is trying to express. Because it's controlled by the opposite side of the brain, they may be able to write it, or they may even be able to sing it, but they can't say it. Because singing is controlled by the opposite side of the brain from speaking. Okay? They may be able to gesture, to point to things like that. And be honest with your patient. If you don't understand them, let them know you don't understand. Okay, what about if you have dementia and Alzheimer's patients? Basically the same things. You want to approach them from the front. You want to keep your voice low and unhurried, and don't use baby talk. Okay? Identify yourself. And don't be offended if you have to say your name to that same patient every single day. Okay? They have dementia, remember? Okay? Keep it simple, yes and no questions. Give them plenty of time to respond. A lot of times an Alzheimer's patient will copy what you do. Okay? Describe everything. Be sure, you let your Alzheimer's patient know what you're doing one step at a time. Okay? And don't talk in terms of time. They can't understand that time concept. Okay? You can use nonverbal communication. Remain respectful. Okay? No, honey, sweetie, darling. I know we're in the South, but you're not supposed to do that. Okay? And when your Alzheimer's patient or your dementia patient does something that's really good, praise them. You did a good job. Hey, you did a great job getting your shirt on. And limit their choices. You want to go for one or two things, not an array of things. Okay? What about language differences?
Turn it into you or
Hmm? How about imagining if you were in a foreign country and you don't speak the language and you end up in the hospital? What do you think about that? Number one, you want to remain calm and focused, okay? If you become frustrated or angry about the situation, you're no good to anyone, okay? And if you're taking care of somebody that's in a foreign country, doesn't speak the language, you gotta kind of feel for them, Okay, find a translator as quick as possible, okay? Check with the staff. Somebody in the building may speak that language. And some apps on your phone will now do that too. Okay. Expand your knowledge. Try to learn a few words in that language. Okay. Let's see. If they have a speech therapist, you want to talk to the speech therapist. They can give you tips and ideas on ways to communicate with the patient. Or you may notice that they're having a specific problem saying a certain thing or pronouncing certain syllables or things like that. They can help you work with that patient to get them where they can talk better, sometimes. But it may be attributed to other things like swallowing difficulties, attention and memory problems, things like that. Okay. Some more communication tips. Expect that it's going to take longer to talk to them. So if you're going in to talk to somebody who has communication problems, plan on being there a little bit longer. Okay? Encourage them to participate and to maximize their independence. Okay? Be prepared. Arrange for some backup communication. They may need a picture board as well as something to write on. Praise every effort that they give you. Okay? Listen closely when you're attempting to communicate with them and clarify what you think you hear by repeating it back. Okay? Stand close by. Position yourself close enough to the patient that you're in their line of vision. Okay? And don't assume that your client understands everything you say. Some do, some don't, okay? Another thing is to manage environmental noise. If there's a lot of activity going on out in the hallway, you may need to close the door, okay? And don't pressure them. All right, what I'm gonna do now is I'm gonna have you break up into groups of 4, and we're gonna start over here, and we're gonna count off 1, 2, 3, 4, and go around the room. So Peggy, you're number 1. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. All right. You're just about 4. 1, 2, 3, 4. 1, 2, 3, 4. All right. All of those that are ones, I want you to move down here in a group. All of you that are twos can move over here.
Yeah, I'm staying here too. Hey.
All my threes, I want right here. And all the fours over here. All right, for all of those cutting and running, you better get back here.
There, I'm part of the two.
I don't know, but I'll find you in a little bit. So everybody come on over. Pick a group and get in there.
I'm here.
I'm camera guy. So I'm camera guy.
You can't stay right there.
You're showing your age to us.
You think I'm stupid? She thought I flipped off the team and she thinks I'm an idiot.
Oh boy, we got all smart people.
All right. Everybody has a team leader on each group. Peggy's over here.
Joyce over here.
Who? Joyce? Okay. This lovely young lady is here, and Vera over there. Now, look at the piece of paper that I gave you.
What about those people back there that aren't in a group, Marianne?
Pick a group and come on.
Pick a group and come on, let's go.
Now, what you're going to do, can I have your attention? Can we listen up? Look at the piece of paper that I gave you. It has a statement on it. You have to figure out how you're going to communicate to a patient who cannot understand you what it says on there to do. Then you have to pick somebody in your group and you have to be able to tell that patient how to do it. Step by step. Okay? Talk about how you do the steps.
I thought I'm the patient, Jackie, and you are the... Like this. There you go, you got it.
And I'll talk about it because I'm going to make you show us in a few minutes.
I don't let you know where my shirt, no?
Yes, I know. Shirt on you.
Okay, step by step. Jackie, you're ready?
No.
So I'm the patient.
I'm not doing it.
I don't either.
We need a shirt.
All of them have dementia or some form of cognitive impairment. Okay? So you gotta break it down. You have to break it down step by step on how we're gonna do it. Okay.
Jackie, you know what? Yeah, that part.
All right, group number 1, are you ready?
All right. Who's the patient? Okay. Show them how to do that.
Let's wait for tons of
The one time, are we gonna be in a front or?
All right. Who's doing it? I don't care.
All right. All right, everybody, group number 1 is going to demonstrate theirs for you. So, Peggy,
We have how to put on a shirt with buttons. Kelly's our demonstrator.
Now you need it. Jackie, who's gonna make it off? The shirt is just like, you know, I'll take care of it.
do it inside out, the right side out. We're going to have the tag on the inside.
So we just
Put
get
one
the
sleeve
pretty.
in.
I'm holding it.
Bring it around your other arm, around the back. Put your arm in the other sleeve.
So Jackie's alright is my sister.
Now that you're done, you want to button your shirt. You can find the very top button. You find the very top hole. And put the button inside the hole.
Johnny can dress himself
And
now.
slide down. Find the very next hole. The very next button. Put the button inside the hole. I would just continue. Okay, so what you can see is sometimes you have to put a little bit more thought into what is going on. So group number 2, what did y'all get?
Tiffany.
We have, what do we have? Put on a pullover shirt.
Here's my patient. Now, you hold.
That's a tiny shirt or
Put the shirt on. Find the tag. That's the back. Lay it down. We're going to put one arm through first.
no baby car.
This arm through. Then pull it over your head. Pull it over your Pull it down. I'll pull it down. It's a little small.
Alright, this is.
Very good, very good. All right. Group number 3.
So real.
What was, you have to tell them what you're.
Oh my God.
Okay, they have to teach somebody how to eat mashed potatoes.
Oh.
How did you like it?
All right.
No, but she's absolutely right. Some dementia patients will do that. They'll try to share it with you. They'll do all kinds of
Spit it
things.
back out at you. Yes. Full. No more. No more.
Very good. Thank you. Yay! Vera, what did y'all get?
We got how to take off your pants.
Do you want music? Do you want music? We're gonna provide music.
Okay, so now you need to tell him what he's got to do.
For safety, I would normally bring them to the bathroom where there's a bar, so they can hold on while they're standing up.
Don't put them down.
So as you can see, sometimes you have to be a little imaginative on how you're going to communicate with your patient. So instead of getting frustrated because your patient doesn't understand you, think outside the box and how you're going to get that message across, okay? Sometimes you have to break it down to this point of saying, stand up, you know, and start there and break it down into very simple steps. Other patients who are more higher functioning or their cognitive level is higher, you can do a little bit less. But most of the time, you're going to have to break it down step by step, okay? Especially if they've had strokes and things like that. Any questions about today?
Nope.
Communication? Make sure you sign in so that you get credit for being in here. And have a great day.